Good morning, everyone. I'd like to call this informational meeting of the House Aging and Older Adult Services Committee to order. I'm Chairwoman Maureen Madden, and let me just say how honored I am to serve as the new chair of this esteemed committee and to have the opportunity to work beside you, Chair Menser. The history of the bipartisanship found in this committee, combined with its much-needed focus on safeguarding our older adults, has always held a special place in my heart, as I was raised by my grandmother. And as a committee, one of our top priorities is to ensure older Pennsylvanians have the ability to stay in their home and age in place. To that end, the men and the women of our local area on aging play a pivotal role in that mission. Back in May of last year, the committee held an informational meeting that touched on some of the basic duties of our AAAs. This meeting serves as a follow-up to that meeting. Just to remind everyone watching, House, under the Department of Aging, Pennsylvania has 52 local areas on aging, commonly referred to as AAAs. It is these individuals that provide a wide array of services and programs intended to help our seniors live and thrive in their homes and communities. Our panel today features two outstanding leaders in the aging community, Karen Leonovich, who is the Director of Policy and Programs for the Pennsylvania Association of Area on Aging, and Beth Harold, who serves as the Director of the Butler County Area on Aging. Thank you both for joining us today.
Thank you, Chair Lady Madden and Chairman Mensker, members of the staff, and the Housing, Aging, and Older Adult Services. I am a bit nervous, so I'll try to speak slowly for you. Thank you for providing us with the opportunity to speak on behalf of the Pennsylvania's 52 Area Agency on Aging and the services they provide to your older constituents. Let me introduce myself. I am Beth Harold. I currently serve as the Director of Butler County Area Agency on Aging and have done so for the past 13 years. I have a BSN from Gannon University, and I have worked as a registered nurse in a variety of healthcare settings for the past 34 years. I also hold an MBA in healthcare management from Chatham University. With me is Karen Leonovich, who is the Director of Policy and Planning for the Pennsylvania Association of Area Agency on Aging, also known as P4A. Karen is a Bloomsburg University graduate with a Bachelor of Arts in Psychology. During most of her career, she has been involved with the Pennsylvania Network of Area Agency on Aging while employed at the Columbia Montour Aging Office. She was a Protective Service Supervisor. She then transferred to the North Cumberland County Area Agency on Aging, and while at North Cumberland, she served as the agency's administrator. Karen joined the PA Association of Area Agency on Aging in 2023 as the Director of Policy and Programs, supporting the 52 area agencies on aging in Pennsylvania. We hope the PowerPoint overview that we're about to present will increase your understanding of what the staff of the Area Agency on Aging do daily for your constituents. Navigating the aging and the healthcare system is not easy, as we all know, and you will see that the Area Agency on Aging are engaged in a wide range of duties and responsibilities to assist your older constituents, as well as their families, their neighbors, and their caretakers. Karen, I'll turn it over to you.
Thank you, Beth. And if you haven't noticed, Beth and I have little squeezy elephants up here. That's how we're managing our stress. And thank you, Beth, and thank you, committee, for having us here today. We really appreciate the opportunity to discuss the area agencies on aging and the good work that they do. Are we going to have the slides? And the gentlemen are helping me with the slides.
No problem. While we're setting up that slide, I forgot one little important detail. We have to take attendance. So if we could start up top and everybody introduce themselves and the folk, and then we'll acknowledge the folks online. Thank you.
Justin Fleming, House District 105, Dauphin County.
Jessica Benham, House District 36, Allegheny.
Paracon, 194th, Northwest Philly.
Joanne Stair, 107th, Northumberland and Schuylkill counties.
And online we have joining us Representative Ann Flood. And I also
Way
forgot.
over here in Westmoreland County,
I'm sorry.
Representative Nelson.
And I'm John.
Thank you, Madam Chair.
I'm John Schlegel, representing the 101st District in the heart of Lebanon County.
So maybe next time we'll practice first. So I hope I lightened up the mood and you all are feeling more relaxed now. And let's start the PowerPoint.
Great, thank you. And thanks everybody for coming, even Westmoreland way out there on his own. And thank you. The Area Agencies on Aging, we consider the keystone for older adults in Pennsylvania. If you could go to the next slide, please. Thank you. The Area Agencies on Aging work very hard to develop and coordinate services for every community across Pennsylvania, whether it's county, local, municipalities. We were established under the Older Americans Act in 1973. That was when the federal government and then the Administration on Aging, now the Administration on Community Living, developed the Older Americans Act regulations and promulgated them throughout the states, and Pennsylvania became one of those states in 1973. Many of the AAAs developed around that same time anyway, because if you remember the 72 flood, there was a lot of assistance needed at that time for the older adults in Pennsylvania. So it all kind of happened at one time. We provide a long range of options for keeping people at home, whether they choose to stay at home, maybe they choose to have their home be a nursing home, maybe they choose their home to be a personal care home. We find various ways to assist them in the community that they're accustomed to living and where they choose to live. Next slide, please. There are, as Chair Lady Madden had mentioned, there's 52 AAAs that serve the Commonwealth. Those 52 AAAs do cover all 67 counties. 33 of them are county-based, which basically means they're county commissioners or the authority within the county manages them. There are 19 that are nonprofits. They have a board of directors rather than the county government that oversees them. They do manage multiple funding streams, so it's not just one chunk of money coming in. There's several pieces of money coming in from different areas that they need to manage. And with that, they're also assisting with contracted staff, or contractors, volunteer programs, and also with employees. We are known as the trusted entities across all the communities in Pennsylvania. We seem to be the one that gets the calls when someone's not sure how to proceed. And we do try to keep people independent, whether it's in the community or where they're accustomed to wanting to live. Next slide. And this is just a quick overview of the AAAs in Pennsylvania. Again, there's the 52 AAAs covering all 67 counties. They're color-coded on there, so you can see which ones may be a single entity and which ones may be a joinder with neighboring counties. And next slide. This is a picture of which AAAs may be county-based and which are nonprofit. You'll see that the nonprofits are in the darker blue. Again, they're the 19 nonprofits, and the remaining 33 are county-based. And next slide. Funding for the AAAs. Funding does not come directly out of taxpayer money. The funding that we receive comes from, about 25% of that comes from the federal government through the Older Americans Act, filtered into Pennsylvania. The remaining 75% or so comes from the lottery fund, from those Penn Care funds that we appreciate that you support. So that's where the bulk of the funding comes from for the AAAs to manage all the services. There are some AAAs that are able to apply for grants. They are able to do fundraising. They're able to receive charity or donations. So that money also assists in providing services at each of the AAAs. And next slide, please. Just a quicker overview of the AAA network. We do have approximately 4,000 employees in the 52 AAAs. Many of them are full-time. There are some part-time employees in the AAAs. Right now, the bulk of those staff are care managers. They're the ones actually out in the homes working with older adults. There's also a large chunk that are the senior center managers for the local senior centers in the state. They are our boots on the ground. They're the ones that are actually out there working with the older adults and helping them and their families and their caregivers get the care they need. We do have, if you look down below that, there's roughly 11,000 volunteers right now in Pennsylvania, which is phenomenal. If you think of all the work that they're helping us do that we may not be able to do, we very much appreciate their time and their efforts on all the work they do. If you happen to see a volunteer of an aging office or you yourself, please congratulate yourselves. This is National Volunteer Awareness Month, so we are very much appreciative. It's actually the last day, so we're very appreciative of our volunteers. On the two side circles, we do have roughly over 20,000 years of experience when you look at all of our staff in the AAAs. We did have a decrease in staff, like most people, during COVID, but we've been able to rebuild. It's been a struggle, but we've been working towards succeeding in that struggle. But we do have staff at some of our AAAs that have more than 35 years experience. So we get in there and we have a tendency to stick around and try to help as much as we can. On average, we serve roughly 500,000 older adults in any given year, plus or minus, depending on what's going on that particular year. Okay, next slide. Just wanted to go over some of our core values and principles at the AAAs. We do have a no wrong door philosophy. Basically, somebody calls us, we'll try to help them, whether it's a service we provide or a service we can refer them to. Many people don't know who they need to call. Most AAAs get the calls from the, hey, I need help getting a battery charged in my car because we're the AAA. So we have some of that, but we all have that phone number handy to give them the correct place to call. But anything, we've had people call and just say, where's the nearest post office? I need help having somebody walk my dog. We can provide that basic information in addition to the other services that we provide. So we like to think of ourselves as a no wrong door agency that you can call us for just about anything, and we should be able to at least provide you some information. Some of the other things, we focus on self-determination and personal responsibility. Older adults have that ability to make their own determination and make their own choices. We encourage that. We encompass a holistic approach, so we're looking at their physical, mental, and social needs, not just a medical need, not just a social need. It's that person, everything is important to them in life. So we look at that whole person to see what they need. We try to maximize their independence and support them in that so that they can remain, again, where they want to live in the way they're accustomed to living. We do value prevention and early intervention. And Beth will speak with this a little bit later, but you think about something like preventative medicine. You go to the doctor for your annual checkup and they check everything out to prevent costly services down the road. We're kind of that same way. The AAAs, whether it's our senior centers or some of our other programs, we're trying to find ways to keep everyone safe, keep them in the style they're accustomed to living, preventing those more costly services as they age. We do provide protection for most vulnerable older adults. Depending on what their needs are, we do ensure that there's some type of protection for them. We are consumer and family-centered. So many older adults have family or care partners or caregivers that are assisting them. We involve them in the care planning process because they're very involved in that day-to-day care. Without them, they may not be able to remain at home. We act with fiduciary responsibility. We try to ensure that we're getting the most bang for the buck in all the services that we provide while keeping the older adults safe. And we do honor diversity. Pennsylvania has a diverse population, so we do honor diversity in all of our AAAs. And next slide. All right, the next three slides are going to show a summary of the services that we provide. And I just wanted to point out that as you're looking at these slides later, you will notice that there's a little tiny, in the right-hand corner of the slide, a little asterisk that says offered at all AAAs. You'll note that those asterisks are up above in the text boxes. And the first one that jumps out to me is care management. All AAAs provide care management, whether it's for an in-home service or other services that we provide. You'll also notice that there's a $sign that says fees or cost share. Depending on the service, there could be a cost share associated with it. It's based on the income for the older adult and other family members, depending on the program, living within the residence with them. So there could be a sliding scale cost share for some of the services that we provide. If you would like to just scroll through the next 2 slides, because it just shows the variety of services we provide. Again, not all services are provided in every AAA. It depends pretty much on the local community, what the local community feels they need. It could depend on funding. We provide those basic services. Above and beyond the basic services, if funding allows, we will attempt to provide those additional services. Some of those services are not offered in that local community. The diversity in our state with the more rural area versus the more urban area, some services just are not offered across the entire state. But we do try to provide as much as we can. And next slide. The next few slides I'll go over are some of the highlighted services that we offer based on those blue slides that blue text boxes you saw earlier. You'll see the assessment of level of care. I always said to our older adults, if you want the government to pay for your care, somebody needs to ensure you're eligible. The AAAs are the ones that ensure the physical eligibility of the older adult if they are receiving a service that would be under Medicaid or, let's say, SSI, where Social Security is helping to pay for that service. We are the entity that is currently contracted to provide the level of care assessments. You may hear as you're out and about the FED. That's the functional eligibility determination. It's a tool that is used. The older adult is interviewed by one of the trained AAA staff. Information is entered into this assessment, and then the assessment determination will decide if you're physically eligible for the care. Along with, it's not just that, it's along with the doctor's review, the attending physician, if they also feel that the person is appropriate for that level of care. You will hear a lot of times that the County Assistance Office is also involved in that process. The County Assistance Office does the financial side of the determination. We do the physical side, the Assistance Office does the financial side. Over time, you might have also heard about the independent enrollment broker. Maximus is our current independent enrollment broker. They are involved in programs with community health choices. So if someone is interested in receiving the managed care community health choices program under Medicaid, the IEB will help coordinate all of that in one big pile. They will ensure that the AAA has completed the level of care determination. They will ensure that the County Assistance Office has completed their financial piece, and then the IEB will work with the older adult to pick the Community Health Choices managed care program that they feel comfortable choosing. So that's how we all kind of tie together. There's a lot of moving parts, and we all work together. Right, next slide, please. Care managed services. Again, that's another big piece of what we do is care management. We have services like our Caregiver Supports Program, where we support the caregiver who's providing the care at home to the older adult. We also have our Options Program, which is the in-home services piece. And most older adults and most people in the public know Meals on Wheels. That's one of the programs that we support. We evaluate the older adult to ensure they're eligible for the program, and then we provide the home-delivered meals. We also assist with providing personal care, home support in certain areas if it's appropriate. So we provide all of those services under a care manage program. So they have a care manager who advocates for them, supports their needs, acts as a resource for them. Next slide. We also have quite the variety of non-care managed services. The biggest one you may hear about is PA Medi, which is our insurance and benefits counseling for Medicare recipients. You usually hear that like October through December. That's our biggest time when there's open enrollment for Medicare Part D for medications. And you usually hear a lot about it come January because that's when there's open enrollment for Medicare insurances. So that is a big program for Pennsylvania, and each AAA has someone in their agency that will help with PA Medi. The nice part with PA Medi is it's not, they aren't focused on a specific insurance plan or specific information. They are there to provide all information and counsel the older adult and the family on what may be their best options. But there's no support coming from a private insurance in order to receive that information. Again, we have the volunteer opportunities. We have transportation. As you know, the shared ride program throughout Pennsylvania. Down here, we see a lot of the rabbit buses. Dauphin County has their services. There is a shared ride program in every county across the state. PennDOT does pay for a lot of those services, but the AAAs through the PennCare item, through the lottery fund, does supplement those costs. We have senior community employment. We do have emergency home delivered meals if there'd be a concern that the older adult may need emergency meals on a temporary basis. We do provide basic legal assistance if someone's in need of, maybe they're being evicted and they need some information on how do I have an attorney, how do I get some help. The AAA can coordinate getting those services together. Senior community centers, the senior centers that all of you I'm sure have heard about, we coordinate those. And we also coordinate the Ombudsman program. And I have a slide that'll go over that briefly. Next slide. Older Adult Protective Services is another service that we offer in Pennsylvania. Older Adult Protective Services does follow PA Code 1544. All AAAs in Pennsylvania do investigate alleged cases of abuse and neglect. And if you look at the bottom of that slide, it does say the types of abuse. Abuse can be physical, sexual, or emotional. It could also be caregiver or self-neglect. We do investigate cases of financial exploitation and abandonment. So those are areas that we do investigate. Reports of need is basically the intake form. That's the easiest way to think of it. Somebody has a concern about their neighbor or a loved one or somebody they've heard something about. They would call into the local AAA. They could provide a report of need. It's basically the intake form to gather the information to see what we need to do to begin an investigation, to see if the allegations are true, and if they are true, how can we assist in protecting the older adult and reducing risk. You'll also see that we have an urgency part there. The urgency section is basically how quickly we respond. So if it's an emergent situation and it's an emergency, the person may pass away or suffer serious bodily injury. If we do not respond immediately, it's emergent. We're going out like immediately. Priority is maybe it's a scary situation. We need to respond quickly, but we can begin some behind the scenes investigation work before we actually complete that face-to-face visit with the person. We need to complete that face-to-face visit within 24 hours. Non-priority, we complete a face-to-face within 72 hours, and where there's concerns and we need to investigate, it might not be an emergent nature, but we are investigating within 72 hours. You'll also see a section there called No Need. The no needs are basically an intake was called in, we completed a report of need, and we no needed it. And it basically means that the situation that was called into us was not, the person may not be eligible for protective services. They may not meet the 5 criteria that we are trained to investigate, but they're probably still in need of a service. That's why the person called us to start with. So just because we say there was no need for an investigation through protective services doesn't mean we no longer are involved. We're usually then seeing them in some other way, whether it's for in our in-home services or the assessment level of care determinations. We don't just get the report and drop it. In some way, we're still following up with them. Next slide. Investigation results for older adult protective services. So we receive the report of need as the intake. The person's in need of services. We can either substantiate or found the case, as Children and Youth refers to it. We can unsubstantiate the case. We can no need the case for protective. So basically, the best way to think of this is the allegations get called in. One of our trained staff goes out and completes the investigation. If the allegations that were reported to us were founded, they're substantiated, we then find a way through care planning with the older adult and the family, the caregivers, whoever's immediately involved with the person, to ensure that the risk is reduced or eliminated in some way. The older adult's involved in the care planning and involved in the entire process. If the case is unsubstantiated, again, the older adults, the allegations that came in and we investigated may not be founded. We may have no need for protective services, which you see as you go down a little bit. But a lot of times that initial report came in because the older adult needed something. So while we may unsubstantiate the case for protective services, we're still actively involved, maybe providing an in-home service or some other service that the AAAs provide. Again, we develop care plans if the cases are substantiated, but also as we're moving forward and assisting the older adult and maybe some of our other programs. The next slide. There is a statewide elder abuse hotline. It's a 1-800 number that's been around more than 20 years. You are able at any time to call that number in. There is a call center that does take reports of need. We also encourage anyone to call the local AAA. And we encourage that because as those calls are coming in, the AAAs are informed of what's going on in the area too. So maybe there's a snowstorm and that may heighten your concern for some type of protective services. But somebody on the call center line may not be aware of that because they may be a few states away. So locally, we're very aware of what's happening in our area. So you can either call at any time the statewide elder abuse hotline. If you call that number, they take that same report of need and intake and forward it to the local AAA. Or you can just call the local AAA and they'll do the same report, gather the same information, and begin the investigation. And next slide. The Ombudsman Program, many of you may have heard of the Ombudsman Program. The Ombudsman Program basically supports and empowers older adults and residents that are living in a long-term care service program. Most often you see them in a nursing home setting. If you've been to a nursing home, you'll see there's usually a poster hanging several places throughout the nursing home saying call the local ombudsman if you have concerns about your rights as a resident of a facility, or if you have an individual complaint that you have concerns about where you're living. That's your home, and sometimes you need to let people know that I want to have some things changed. You're welcome to call an ombudsman, which would help navigate that system and help work through the process. It's a great program. Several volunteers are managed in that program, and they do a great work. It's not necessarily a program that is looking at protective services. Ombudsman, again, will support and empower the older adult with their individual concerns at the facility. If it's a case of abuse or suspected neglect at the facility, then the protective services staff are involved. And next slide. And next slide, please. That's okay. Thank you. And we wanted to end my portion of this on a happier note. Our senior community centers. There are roughly 450 senior community centers throughout Pennsylvania. Each county has a few. Each AAA will somehow manage that, whether they have the senior centers under their immediate umbrella or whether they contract out to another entity to support their senior centers. Senior centers, I always thought of a lot of the entry point to working with an aging office. It's a community place. It's a place for older adults to gather for socialization. We do health and wellness programs for health promotion. Again, we're trying to look at educating now so we don't have risks later. We've done health screening, there's education, nutrition services. You can attend a senior center on any given day and receive a warm meal or a meal, usually a warm one, but you can choose a colder meal if you choose. But there are services for someone to go have a meal together and have some socialization with that. And there's also a great deal of recreation. A lot of bus trips go out of there. A lot of casino trips run out of the senior centers. Great programming. It's a great way for older adults to gather in a group and spend time together and still be learning and still be active in the communities. It's very similar to other fraternal organizations across the state, except we have our senior centers, it's geared towards the older adults. And next slide, please. Before I turn it back over to Beth, I just wanted to encourage everyone, if you don't already know your local AAA, whether you've met the director or any other staff at that AAA, we highly encourage you to reach out and get to know your local AAA. Again, there's many services that are offered that a lot of people don't know about. And some of the services they provide are the same ones you may be providing. Help with the tax and rent rebate applications, help with the PACE applications. The AAAs are doing the same thing, whether it's at their office or at one of their senior centers or in community events. You can be partnering to do a lot of those things together if you choose to. They're also a great trusted partner. If a constituent comes to you and they have questions, you can call the local AAA and they can kind of navigate through the field for you to get information of what you need. So we always encourage that you at least get to know them and get to know who they are. They may already be attending some of your events, but it would also be great for you to get to see them and attend some of their events. Great. Does anybody have any questions from the PowerPoint?
Thank you. Thank you so much. And before we get to questions, though, I'd like to acknowledge that Representative Serrato and Representative Brown have joined us. And so I have a question.
Sure.
In your testimony, you mentioned that AAA services can save the Commonwealth money by allowing folks to stay in their home longer. Can you expand a little bit on that?
Take that one. Okay, we're going to pass that one back to Beth.
I can take that one. The services that we provide through the Aging Network can definitely save the Commonwealth money over the years. And what I mean by that is if you can keep individuals in their home or what they consider their home, whether it be a senior high-rise, an apartment, or their home, a month, 3 months, a year longer, and they don't have to go to that next level into a skilled facility, you're potentially saving the Commonwealth thousands of dollars. A skilled facility is looking at $13,000 to $15,000 a month, where we could potentially provide a care plan at $500-600 a month with some simple meal prep services, helping an individual with their bathing and helping them do some light housekeeping. that we can keep them in the lower cost environment, which mentally is sometimes a lot better for them than moving them into a facility. So if you look at that long term, and if you look at some of the health promotion activities that we do at the senior centers, and that we even reach out into the senior high rises, the population in Pennsylvania is aging. You all know the statistics from the Penn State, that the aging population is going up. But if you look at, fast forward to the year 2040, let's go to that year. The aging population at that time kind of levels out and steadies, but you know what population does increase? You're 85 and older. So if we can get and work with that population, the 60s, the 65, the 70-year-olds, and keep them as healthy as they can by providing them meals, getting the medications that they need, doing fall prevention programs, providing them with healthy tips for living, we can keep that population healthier as they move through the healthcare spectrum, that it can ultimately save the Commonwealth millions of dollars. So that prevention part and really wrapping people with services in their homes can save a lot of money. I hope that answered your question.
Yes, it does. Thank you. Chair Menser, do you have questions?
Thank you, Chair Madden, for scheduling this informational meeting, and welcome to Aging and Older Adults. My question has to do with Nexus. It's my understanding that, and correct me if I'm wrong, that the AAAs were providing the same function as Nexus up until about a decade or so ago. Is that a correct assumption?
I'm not very familiar with Nexus, so
Oh, okay.
the AAAs.
Maximus, I mean.
Oh, Maximus. No,
Maximus.
we're separate. The AAAs have been around quite a while, since 1973. And actually, the Older Americans Act developed in 1965 through the federal government. So they've kind of directed how we've been up until, oh boy, I can't even remember, probably a good 12 years ago, I'm going to think. The AAAs assisted older adults as older adults enrolled into the managed, not the managed care part, but the waiver. It used to be called aging waiver. The AAAs did assist older adults as they transitioned into waiver. So at that point, we were helping them fill out paperwork. We were still doing the level of care. We were meeting with family. We were meeting with the doctors. We were the entity that was helping with that transition. As managed care rolled out and the federal government said, ooh, we need to make sure this is non-biased, that's when the independent enrollment broker was established. So they came in just prior to managed care rolling out in Pennsylvania, which did away with aging waiver as we thought of it and looked at it as community health choices as one big group for anybody 18 and over that needed a Medicaid service. So while the AAAs still will assist older adults with gathering documents, especially if we know them and we're already care managing them, and they've gotten to the point where they need to transition to the community health services program, we are not the coordinator of that above. We help the older adults as much as we can. We complete the levels of care as we have always done, but Maximus is the one that coordinates the CAO and us and the older adult to get the services they need.
Okay, thank you. Just to follow up, have you experienced, I've had constituents that complain about the length of time it takes for them to qualify for some of these life programs. And by the time they qualify for some of the life programs, they wind up in a nursing home, which costs a lot more money.
Yes.
As representatives of the AAA, could you make suggestions to us how we might streamline it?
Ideally, they could get onto the program without having to go through the financial part is usually the longest part. And I can honestly say, in doing the same thing for my mother, it's a process. There's an application that needs to be completed. You have to gather bank statements. You have to gather documents. You have to prove that your loved one is financially eligible.
It's very different. It's very difficult for individuals as they age. You know, hearing not isn't as well. You're not seeing as well. Your dexterity, technology is very difficult, and they're asking for documents. They're calling on the phone, so you can't hear what they're asking. We tell our seniors, don't answer those robocalls that are coming in because of so many scams, and they will call on those robo-type calls. And then when you're trying to get the bank documents, they can't get what they need. We were always there to kind of help and handhold and get through that process, where now it's a little bit disjointed, which causes some delay in the process. Because if they miss a deadline, it kicks them out or starts
Yes.
them back
have
a
to
few
start all
squares. And
over again.
It's very frustrating. It's very difficult for individuals. I didn't mean to jump in.
that's
I'm
okay.
sorry.
So to answer your question, I really don't know how to answer that question other than streamlining the process for the older adults to become eligible financially is the hardest challenge. And because of the things Beth said, they're often living alone, they don't have family nearby, they're frail. That's why they're looking for that program. So they can't just run down the street to the bank and get their documents. They can't just find their life insurance policies. There's a lot of process involved with it. So streamlining that in some way, I think, would be very helpful.
Okay, and I don't want to dominate this, but is there any possibility that we could, as a state, offload this onto the AAAs who are more sensitive to the process?
That's not for us to determine.
Okay.
Yeah, we'd take it back. The federal government had made that initial determination.
Thank you.
But we would take it back.
I'll turn it back to the chair.
Thank you.
Thank you, Chair. We have a question from Representative Benham.
Yes, good morning, and thank you for your testimony. I appreciate it. I have a lot of older relatives in my district who are caring for younger family members in the absence of their parents. And we do a lot in my office to try to connect them with resources to support them as they do that. You know, many of them are very grateful for the kinship care process that the legislature created. But with that has come some difficulties in ensuring that they can access needed resources that if those kids were in foster care, they would have had access to. So if you can walk us through a little bit what you might offer to older adults who are caring for younger family members, that would be helpful.
Sure.
Well, one of the difficulties with that program is that you need to be 55 or older to get the benefits of that program. And many of the grandparents that we see that are taking care of their grandchildren are not 55 or older. So we have that whole segment that aren't getting the resources that they need to support those. And I think the other caveat is that you need to have custody, or you need to have kind of control of that child under certain regulations, and that isn't always happening. So I probably didn't word that correctly, but those are two difficulties with that program with taking care of grandchildren, where we see numerous grandparents taking care of their grandchildren, and it is a wonderful program. It can provide, you know, back to school clothing, boots, furniture, reimburse at programs for them, such as dance classes and things to keep them integrated into the community.
I think the best advice would have them call the local AAA. The local AAA would be able to walk through whether they'd be eligible to start with based on the criteria that we have, and then get them in through the process, which is basically an assessment to assess the grandparents' need, assess the need of the grandchildren, and determine what we can do to support them. If the grandparent is not 55, then we can at least attempt to refer to programs in the area. That is definitely a growing population that is not currently being served.
Thank you. I appreciate that. Just a quick follow-up. Are there ways you would recommend that we should change that program? You talk about the difficulties with the age limit requirements, or are there other things you would change about the program?
The program that we follow right now is one of the national programs that provides the funding for the grandparent program. So that there would be that piece of it, but there's also Pennsylvania's Caregiver Act, which does not currently include the grandparents, but it is something that could be visited down the road.
Thank you.
Next, we have a question from Rep. Nelson.
Thank you, Madam Chair, and welcome to the committee. I look forward to working with you. I wanted to first start out with an enormous thanks for our Westmoreland County AAA. You know, they do so much in the community, and whether it's, as you're touching on, concerns of adults, we just had them just in the last couple of weeks. CHC had misdetermined somebody that gets a letter and just sends enormous ripples of fear through a family that all of a sudden their services are going to end. And immediately our AAA was able to respond, be on a call, schedule a reassessment. And I mean, the calm that you're bringing to the full family environment and the facility itself. So thank you for what you guys are doing. My initial question was in the area of fraud, and another huge help that the AAAs do. But as the fraud cases are growing, you know, is the AAA supported enough in that arena? Because as you were saying earlier, it's a lottery fund. It's not necessarily a line item in the budget. And are there some ways that we might be able to create a new pathway to help the AAAs better support fraud in these areas throughout the state?
Fraud has become a very big concern in our agency. We have a very strong relationship, I could speak from Butler County, with our state police force that help us a lot with the bigger fraud cases we have, and we work with the Attorney General's office. But there can be more support. Some of those fraud cases are becoming very much into retirement accounts and different bank accounts and things that are far above our knowledge level when it comes to finance. It used to be people would have 1 or 2 bank accounts and, you know, you could go through those. But when you're looking at investments and bank accounts and convoluted ways they can get in, it becomes very complicated, that having additional resources for those fraud cases would be helpful.
Are you familiar with we met with some of our community bankers that there is a bill that they are supportive of that would allow a local bank to put a slight hold until the AAA could give the green light. There wasn't a bad actor. Can you touch on that? I mean, it's not an endorsement.
I don't really know much about that. I do know that we are getting much more of a partnership with many of our banks, and they're communicating their concerns to us a lot more, which has helped with us. But I'm sorry, I can't really speak on that bill. I don't know a lot about it.
I do know the association itself is currently reviewing the bill to see if there's appropriateness or changes or amendments, so we are currently reviewing it, but we don't really have a stand on it right now.
That's great. And that you know, everybody has so many questions for you guys, but the Maximus issue, which is just a 4-letter word for AAAs in Pennsylvania, you know, the level of service is nowhere near. Following up on our chair's question, would there be an opportunity for a bipartisan initiative? When they did that assessment, it was because in some more rural areas of Pennsylvania, referrals were going to another agency. If we had a more clear firewall between the AAA assessments and maybe some of the facilities, because there was limited choice, so some people were choosing, like, can you touch on that firewall? If we clarified our firewall, could we go back and have those dollars invested more within our AAA, quicker, better, faster?
Possibly. I know at the federal level, conflicts of interest is all over the place. So every program we touch has some way we need to address conflicts of interest. So as the programs are rolled out federally, in what they consider conflicts of interest would need to roll out into Pennsylvania, because it doesn't just cross the aging offices, it would cross Department of Human Services, Department of Health, so it would take initiative amongst everyone.
And
to see
I'm
what
not
they could
sure,
do.
since we no longer provide the aging waiver services, it's a CHC entity that provides that. I'm not sure how deep that conflict would be right now, because we don't financially gain from deeming somebody as in a waiver program, because we're not providing the waiver services, if that makes sense. There's a separate entity. So that might be something we would want to look into.
That's great. Thank you. Thank you, Madam Chair.
Thank you. We have a question from Representative Schlegel, and we have about 5 minutes before we have to wrap up and be on the floor.
Thank you, Madam Chair. And first of all, I'd like to just echo the great job that I think the Lebanon County Office of Aging is doing for our senior citizens. In particular, I've had a constituent that has some concern with a policy that with one of the they have a loved one in one of their nursing facilities, and it's really a DHS policy. We're going to work through that policy with DHS, but we really appreciate the Budsman's involvement and level of empathy on behalf of the family. But my question is this, though. You talked about the voter registration services that are provided. And I was wondering if you could describe that a little bit, please.
Okay. As we look at each other. Each of our AAA staff that go out and complete assessments with older adults in the home are required twice a year to complete a Department of State mandated training, which basically teaches them to ask every older adult if they want to vote, and if they do, are they registered? And if they're not registered, how we get that information to them. So if we have older adults that choose to vote, but they're not currently registered, we can provide the documents to them and ensure that they have the information to get them returned back to voter registration. So that's kind of our piece of it, having the documents go back and forth to ensure that they're registered and they have the ability to vote if they choose to.
Can I do the conclusion? Okay. In conclusion, and we are happy to answer any questions you might have. You can reach out to Karen and I after this meeting. But as you might surmise, during the COVID pandemic, the number of older adults calling for help increased dramatically in all of our offices. It was an incredibly difficult time for our older adults and their families and the workers who cared for them. For example, in Butler County alone, the number of older adults needing home-delivered meals increased from about 300 individuals per month to well over 700. We supplemented those meals with milk and cereal, bread, lunch meat, cheese, delivered each week with 7 frozen meals. And we were continued to be their lifeline to the world, a friendly face, a hand to hold, a constant in such a time of uncertainty. We became their friend. We became their confidant. Fortunately, the federal government and you in the General Assembly allocated the American Rescue Plan Act funds to help the Area Agency on Aging meet the rapidly expanding call for services. This enabled us to care for the most vulnerable among those that have given so much of themselves to our communities in a time of uncertainty. However, the ARPA funds will expire this year, but the need does not. In fact, it continues to grow. My agency alone is looking at a close to a $400,000 decrease in funding, and that is an 8% shortfall in our budget. And this alone will keep me up at night wondering how I'm going to meet the needs of those that we protect. Without the influx of the additional lottery funding proposed in the Department of Aging's 24-25, AAAs will need to reduce services and waiting lists will get longer, as well as the services we may need to decrease or eliminated. This will necessitate taking drastic action, such as reducing home-delivered meals, or reducing the number of senior centers, or the number of days that they are opening, reducing home care visits, and so on. The services that save our Commonwealth millions of dollars by enabling individuals to stay healthy longer in their homes and communities. Finally, we ask you to support the Department of Aging's budget request. We also ask you to contact your local Area Agency on Aging director, as Karen asked you. I believe you'll be surprised at the number and the intensity of services that your constituents are in need of. Thank you for your interest and attention to assisting the older adults in your community. Thank you.
And thank you, ladies. Thank you for your valuable information and testimony. This wraps up our meeting. Please keep an eye out for upcoming emails, as we will continue to hold informational and voting meetings throughout the year. Keeping with the theme of helping our older adults age in place, we are finalizing the details for our next meeting, which will be the LIFE program. This informational meeting is adjourned.